and we will go ahead and get started. So thank you all for coming. My name is Erin Tersegno, for those of you who do not know me, and I am a PGY1 Pharmacy Resident here at Stony Brook. And today I will be presenting my technician and pharmacist continuing education presentation on Garbing Up to Face the Hazards, a review on hazardous drugs and safe handling. I have no disclosures. And I would like to acknowledge John Bruno, Amanda, as well as Caesar for their assistance in this presentation. Our pharmacist objectives for today will be to recall medications identified as hazardous drugs, identify appropriate disposal of hazardous drugs in various settings and situations, differentiate the associations that set standards for their use, memorize the processes and procedures for disposing as well as cleaning up any spills, and then recognize personal protective equipment requirements when we're handling hazardous drugs. Our technician objectives will be to describe the risks associated with hazardous drugs, identify appropriate personal protective equipment as well, memorize who actually is at risk of harm when handling, discuss regulations pertaining to the disposal, as well as be able to list the resources that are available to us to reference hazardous drugs and their handling. Now, I've said it a lot already, but what are hazardous drugs? They are drugs that can cause adverse health effects if healthcare workers that handle these products are exposed to them. Concerns of occupational, so work exposure to hazardous drugs actually first appeared in the 1970s. And the CDC approximates that about 8 million US healthcare workers are potentially exposed to hazardous drugs. And this includes pharmacists, pharmacy technicians, nursing personnel, even operating room personnel, and the list goes on. The workplace exposures can cause various health effects, and that being acute as well as chronic. To give you some examples, an acute health effect would be something like causing a skin rash. And the chronic effects could be something like causing reproductive effects, so leading to infertility as well as spontaneous abortions. The literature even notes that some exposures can lead to causing leukemia or other cancers. Overall, the risk does correlate with 1, the degree of exposure, and 2, the toxicity of the drug. And both of these have a direct correlation. So as we increase our exposure and we increase the toxicity of the drug, there is going to be an increased risk. Now, there are set characteristics that make drugs hazardous, and I have them on the screen here. First being carcinogenic. So if the medication causes cancer, if they're teratogenic, or reproductive toxicity, meaning that they can cause birth defects. Some medications are actually directly damaging to the DNA. So this would fall under the genotoxic category, and then also causing organ toxicity even at smaller doses. It is important, however, to make this distinction that there are still therapeutic conditions where the benefit of using these hazardous drugs outweighs the risk, and that's why we still handle them in the healthcare setting. However, for today, we will be focusing on specifically the potential for occupational exposure when we're handling these hazardous drugs. Now, given that information, I wanted to start off today having some literature to support really what we're going to be talking about for the remainder of this presentation. Here I present a study on the reproductive health effects associated with occupation exposures to anti-neoplastic drugs, meaning drugs that are used to treat cancers. The study was a literature review of 18 publications of occupational exposure and reproductive outcomes, and these studies ranged from the 1980s to February of 2014. The population that was included was variable and included pharmacists, nurses, as well as other hospital workers. The first result that this study looked at was the effects of occupational exposure on congenital anomalies. They specifically looked at 8 studies in which all studies had less than 20 exposed cases. And of those studies that reported more than 5 exposed cases, 3 of those actually showed a significant increased risk associated with exposure. And this accounted for an odds ratio of adjusted models that ranged from 1.36 to 5.1. And if we remember, if an odds ratio is greater than 1, that means that this occupational exposure did lead to an increased risk. Also, as you can see, some of these odds ratios were statistically significant. So referring to 5.1 at the bottom of this table, as you can see, that confidence interval there does not cross 1, meaning this is a statistically significant finding. The second part of this study looked at the results on miscarriage, stillbirth, and tubal pregnancies. They examined 8 different studies, and 3 of these 8, the largest studies, showed statistically significant increased occurrence of miscarriages among women who handled anti-neoplastic drugs in the first trimester. Interestingly, most exposures were found among pharmacists as well as oncology nurses. And the meta-analysis found an overall adjusted increased risk of 46%. There were some limitations to the study. First and foremost, there was a small as well as variable population sizes included, and the data was pretty outdated. So if we remember, they included studies from the 1980s, and the occupational risk was first assessed in the 1970s. So I'm sure we all know we have made significant advances since the 1980s in how to really protect ourselves against hazardous drugs. But really overall, these findings generally were associated with an increased risk of adverse reproductive outcomes with occupational exposure. Now, given this information, we have literature to kind of support what we're going to be talking about today. How do you think you can protect yourself against hazardous drugs, especially since our audience here works in the pharmacy, and a lot of us might be exposed to hazardous drugs almost every day? And feel free to type anything you want in the chat function. Yes, so someone in the chat wrote PPE, and this is exactly correct. So there are a few categories here. We have engineering controls, personal protective equipment or PPE, as well as work practices and procedures. What are engineering controls? Engineering controls for hazardous drugs specifically are designed to minimize worker and environmental hazardous drug exposure. On the left-hand side of the screen, you can see something that's called a biological safety cabinet, and this is specifically recommended engineering control to be used when we're compounding hazardous drugs. The reason for this is, as you can see with the picture, this pharmacy technician or the pharmacist is protected with this screen that goes across her front face. The reason for this is we want to protect our workers against any potential fumes as well as aerosols that might be coming from those hazardous drug products. To add on to this, there is also a specific type of airflow that's being used behind the scenes here. And that brings us to the picture in the middle of the screen. It's called a vertical airflow. This is recommended as an engineering control for all types of hoods that are used to compound hazardous drugs. In comparison to the horizontal airflow that's used for non-hazardous drugs, it kind of makes sense, right? So if we're utilizing horizontal airflow, as you can see on the right-hand picture there, that air is going to be coming out directly at the pharmacy technician or pharmacist who's compounding. And our goal overall here is to minimize our exposure. So because of that, we have this vertical airflow. And vertical airflow, as well as the biological safety cabinets, those are used in our cancer pharmacy over in the MART. And then this horizontal airflow is what's used in our IV hoods in the IV room in the main pharmacy. Now thinking about where can this exposure occur? Exposure can first occur in the manufacturing and transport process. All employees have potential for contact with trace contamination. And transportation is important to consider, as well as the manufacturing process, because medications that move throughout healthcare systems, there is always potential for breakage during these processes. And if there is breakage during transport or manufacture, there is going to be a risk of contact when we're receiving and unpacking these orders due to contact hazardous drug residues that can either be present on drug containers, individual dosage units, as well as even the outer containers or the floors surrounding these containers. Also, there's always going to be a risk for exposure when we are dispensing medications and compounding medications. And this is why there are special procedures and SOPs that are in place during compounding, like I talked about on that last slide with our engineering controls to protect the healthcare workers. With administration, there is a risk of exposure from aerosols, and this is consistent even with various administrative techniques, including things like oral formulations, injections, irrigations, and even topical applications. The next spot for exposure occurs during patient care. This might not be as applicable for us as pharmacists and pharmacy technicians, but here the exposure comes from handling bodily fluids or bodily fluid contaminated clothing, as well as any linens. And lastly, spills and waste, there is always going to be the potential for exposure. Circling back to the receiving, handling, and storage, when we are receiving hazardous drugs, it's recommended and required to unpack these hazardous drugs in either a neutral or negative pressure air. It is not recommended to unpack hazardous drugs in a positive pressure area or an area that's in a sterile compounding. Because of that risk for trace contamination, there are specific handling requirements, including gloves. They must always be worn when handling our hazardous drugs. And then finally, when we're thinking about the storage, there are special storage requirements for all hazardous drugs. And this is kind of broken down between anti-neoplastics, so drugs used to treat cancer, and our non-anti-neoplastics. Anti-neoplastics must be stored separately from non-hazardous drugs. The exception to this is if the anti-neoplastic is in a final dosage form, meaning that we're receiving it from the manufacturer in, for instance, a tablet or capsule, and we will not really have to render this formulation before dispensing it to a patient. Non-anti-neoplastic hazardous drugs may also be stored with other inventory. Thinking about now, what really are those standards and resources that we have that really set those standards for dealing with hazardous drugs? First and foremost, we have the U.S. Pharmacopoeia, which is also known as the USP. I will be referring to this as USP from now on in the presentation. We also have our safety data sheets, as well as the National Institute for Occupational Safety and Health, also known as NIOSH, which I will refer to as NIOSH in this presentation. The USP is an official pharmacopoeia of the United States, and it's an official reference that is recognized by various entities, including the FDA, as well as the CDC, and it's interpreted on a state-by-state level. The USP sets standards for compounding preparations, and the chapters in the USP are considered to be the minimum acceptable standards when dealing with medications. There are many chapters within the USP. However, the three main ones that I wanted to focus on today and differentiate between are included in this circle on the slide. So we have our USP 795 at the bottom. We have our USP 797, and then we have USP 800. USP 795 sets the minimum acceptable standards for non-sterile, non-hazardous drugs. USP 797 sets the minimum acceptable standards for sterile non-hazardous drugs. And then USP 800 sets the minimum acceptable standards for our hazardous drugs, which we will be focusing on throughout this presentation. Thinking about our safety data sheets, these are a series of safety documents that are required by the Occupational Safety and Health Administration, better known as OSHA. And each hazardous drug has a specific safety data sheet with information on it. It comes with a lot of information, but three key ones I thought would be important for us to know so we can reference later on if needed, is it'll tell you the specific personal protective equipment, first aid procedures, as well as spill cleanup procedures that are specific for a specific drug. These must be accessible to all employees who work with hazardous drugs. So how can you find these safety data sheets? It's actually pretty simple. If you go onto our intranet on the Pulse and go to drug references, we can find these safety data sheets under the Lexicomp safety data sheets, as well as the Micromedics in-depth interface. If we go to Lexicomp, it's pretty straightforward. You search the drug in multiple ways and it'll bring up these data sheets. Micromedics is a little bit different, however. So you would first have to go to the database of Micromedics. You would then type in the drug in the search bar as follows. So I picked warfarin because that is a hazardous drug. After you type the drug in, you can either click enter or search that magnifying glass there. That'll then bring you to the main sheet for warfarin. From here, you're going to want to look on the right-hand side of the screen at related resources and pull up toxicology. And I'll zoom this in for you to get a better look. After you click on toxicology, it'll bring you to this pop-up where you can click on the MSDS from the USP. And that'll take you directly to the safety data sheet that will give you all the information, again, on personal protective equipment, first aid procedures, as well as procedures for the specific drug that you are inquiring. Now talking about NIOSH. NIOSH is a list of all hazardous drugs called the NIOSH list of anti-neoplastic and other hazardous drugs in healthcare settings. The list is reviewed at least every 12 months, and they try to publish a new list at least every 2 years. So really it's a list of hazardous drugs, and they determine which drugs are hazardous. Now, given this information, if we saw a drug on the NIOSH list, how would we know to handle this drug? What USP requirements would we handle it by? So is that the 795, 797, or 800? Okay, great. Yes. So this is going to be the USP 800 requirements. NIOSH's approach involves categorizing hazardous drugs into 3 groups, that being anti-neoplastic, non-anti-neoplastic, as well as those with reproductive hazards. Anti-neoplastic drugs, once again, are used to treat cancer, and many of these drugs pose a reproductive risk for susceptible populations. Non-anti-neoplastic drugs, they will be included on the list if they meet at least one of the NIOSH criteria, and some of these may pose reproductive risk as well. And then we have medications that are specifically categorized under reproductive hazard. So they primarily pose a reproductive risk to men and women who are actively trying to conceive, and women who are pregnant or breastfeeding. And once again, keeping in mind that even though these medications have these risks, there are therapeutic places in therapy for them. The NIOSH list has about 200 drugs, and it's actually also on our Pulse intranet website where you can reference it. So you can go to resources, departments and divisions. If you go to the environmental health and safety under chemical safety, you'll be able to find a link to the NIOSH list. I also wanted to point out on the Pulse under drug references, we have a specific section that'll bring you to the hazardous drugs that we specifically have at our institution. Looking at the NIOSH list of hazardous drugs, right now, the current finalized list is from 2016. So now you might be thinking, you just said they try to review it every 12 months and they try to publish every 2 years, which is true. However, they are about 4 to 5 years behind at this point. And they do acknowledge this. If you go to the CDC's website, they will let you know that. And keeping this in mind, this does not mean that drugs have not been added to the list since 2016. So if we want to reference any new medications that could have been added, if you go to the CDC's website, they will have a list of those medications. They also have posted a 2020 draft, which is hopefully going to be published within the next year. Now, my next question for the room is, what are some medications that you know are hazardous that would be included on the NIOSH list? And feel free to unmute yourself or just type in the chat function. Yes, so I see Melinda said warfarin, which is great. I think warfarin is a big one that all of us might be familiar with. But I have this specific section here because all of these drugs, it might be surprising, they're non-anti-neoplastic medications, but they are all considered hazardous. Medications like paroxetine, fluconazole, clonazepam, these are meds that we might be working with almost every day. And it is important to note that they are considered hazardous. So there are specific policies and procedures we should be abiding by when handling. Tying that back into a slide I had on the earlier part of this presentation, these are the characteristics that make those drugs hazardous. And I created this table to give you kind of an example. And if you always wanted to look back at the NIOSH list, they actually have the drugs listed with the specific characteristic that makes them hazardous. Now looking at safe handling with the USP 800, so the minimum acceptable requirements for hazardous drug handling. A hospital must follow USP 800 containment strategies for all hazardous drugs. Hoods and buffer rooms in the IV rooms used for compounding hazardous drugs will all begin with containment. And containment is required to keep hazardous drugs, particles, and vapors contained due to toxicity risk. For example, we have our containment primary engineering controls, or the hood. We also have containment secondary engineering controls, which is the room in which the hood is placed. As you can see on the right-hand side of the screen, this is an example of a containment primary engineering control. You can also think about that biological safety cabinet that I had on an earlier slide as well. In an ideal situation, we would handle all hazardous drugs in every dosage form on the NIOSH list with all of the containment strategies, so utilizing those hoods and buffer rooms and work practices that are identified in USP 800. Is this possible in your opinion, as well as practical in every case? Yes or no? Yes, no. And this is understood that it isn't always possible and practical in every case. So there's an exception to this rule, and that is called the assessment of risk. The assessment of risk allows the pharmacy to opt to conduct for lower risk hazardous drugs to really choose not to utilize those containment strategies. Overall, it's a plan that we would opt to handle the lower risk hazardous drugs. And an example of a lower risk hazardous drug is something that's available again in a final dosage form, meaning it comes to us in, let's say, a tablet or a capsule or even a cream, and we will not have to manipulate it before dispensing and handling the medication. The plan must include actions to limit staff exposure. I have a few examples here. So for starters, we have medications in distinct bins. This is the reason why we have in our VC, in our main pharmacy, we have all of our hazardous drugs put in black bins. If you see a medication in a black bin, that should tell you right away that this is a hazardous drug. And there are specific, for instance, personal protective equipment that needs to be worn when handling. Another plan could be enforcing chemo-rated gloves to be worn. Also, dedicated counting trays and spatulas. This might not be as applicable to us in the hospital, but I know in our community and retail pharmacies, they will have specific counting trays, spatulas, and even designated areas to, for instance, count something like warfarin tablets to dispense for a patient-specific prescription. Overall, the assessment of risk is required to be reviewed on an annual basis, and an assessment of risk is specifically for a drug as well as a different assessment of risk for a different formulation of the same drug. What is this really all about? Overall, it's to establish containment strategies and work practices best known to control hazardous drug contamination and help protect us, the healthcare workers. There's a hierarchy of controls that we can do this, starting with the most effective at the top, leading to the least effective. The most effective way is eliminate, so physically removing that hazard. But as I said before, this isn't always possible, as many of these drugs do have a place in therapy. And this kind of goes hand in hand with the next hierarchy, substitution. So if we can't do that, we can in place our engineering controls by isolating people from the hazard. But like we talked about before, that isn't always possible and practical in every situation, especially if we're dispensing tablet formulations that are prepackaged. So here we can administer administration controls to change the way people work, and then implement personal protective equipment to protect us from the occupational exposures. You can find our assessment of risk online as well. If you go to the Pulse and go under departments and divisions under pharmacy, that'll take you to this screen on the right-hand side where you can click on educational material. And there we will have two assessment of risks, one for chemotherapy drugs and one for hazardous drugs. To give an example of what our assessment risk looks like, if you haven't seen it already, it looks like the top part of this screen. So it's going to give you ways to manipulate the medication, dispense the medication, as well as dispose. Our first example I have is finasteride, which is a non-anti-neoplastic medication. When we are handling this medication and taking it out of our VCs in the main pharmacy, it is recommended and required to utilize gloves. And we can see that by that picture, if you can see on the right-hand side, that indicates gloves are needed. This sticker will also be on the black bin that finasteride will be in. So when you are dispensing this medication and pulling it out, you will know right away that you are required to wear gloves. And 1 pair of nylon gloves is acceptable for this medication to help mitigate that risk. It also has to be stored in a designated area. So again, this is going to be our black bins and the VC or the vertical carousel. The risk here is really a reproductive hazard, especially for pregnant patients. In the first trimester, there is a risk for a male fetus. And then disposal of this medication, it should be disposed in a yellow bag. And I will talk about more in depth later on these disposal colorings of bags. The next example I have is another non-anti-neoplastic, warfarin. Gloves here are still recommended. It's still going to be in that designated area. The risk with warfarin is adverse reproductive effects, but the disposal is a little bit different. The disposal of warfarin is in a black waste bucket. And the reason for this is because warfarin falls under what's called RCRA, RCRA, or Resource Conservation and Recovery Act. It falls under this criteria because it is considered to be acutely hazardous and lethal at even small doses. So the disposal is more specific to help conserve our environment when we are wasting the drug, or even the bottle that the drug comes in. My last example is an anti-neoplastic medication, so imatinib, sold under the brand name Gleevec. This is a medication used for cancer, so it has use and place in therapy for acute lymphoblastic leukemias, as well as chronic myeloid leukemias and so forth. The handling here is pretty similar though as well, and it can also be found in our vertical carousel, so we need to use gloves. The risk here is adverse reproductive effects, and this disposal is different since it is a chemotherapy anti-neoplastic medication. It needs to be disposed in a chemo waste bin if it's unused, and if it's an empty package, it can be disposed in the trash. Overall, summarizing that, all hazardous drugs must be stored in a designated area, and appropriate stickers must indicate the proper handling. Overall, there is risk for all personnel when handling hazardous drugs, including pharmacists, technicians, nurses, lab staff, janitors, and so forth. Do we think, given that information, this statement is true or false? Both women and men of reproductive capability are at risk for reproductive harm due to occupational or work exposure of hazardous drugs. Great. Yes, this is a true statement. And I think it's important to acknowledge the fact that it's not just women, it's also men of reproductive capability that are at risk of reproductive harm. Now diving into our labeling. When we are dispensing a hazardous drug, it is recommended to place these drugs in the yellow plastic bag that you have on the left-hand side of the screen, as well as add the appropriate labeling stickers. And then at the bottom hand, you can see these is what is going to tell us how we need to handle this drug. Therefore, if we see on the left-hand side on the lower of the screen, gloves required, we are recommended to wear at least 1 pair of nylon gloves to mitigate the risk, even if we're taking the medication out of the vertical carousel that's already in its prepackaged formulation. Gowns are required if you see this sticker in the middle, and then a mask is required if you see this sticker, which I know is not a problem now when it comes to COVID, but if things ever change, it's important to keep this in mind. Another thing to point out is there are nursing alerts when they're administering hazardous drugs. When they administer the medication in the MAR here, it's going to give them a pop-up letting them know that there is caution because they are handling a hazardous drug, and it can even take them to a link for the NIOSH with specific handling recommendations. Thinking about our personal protective equipment, or PPE, the main reason here is, of course, to provide protection from hazardous drug residue and aerosols during preparation. Sites overall are required to have a policy identifying appropriate PPE. To give you an example of gloves that are compliant for hazardous drugs, they must be American Society for Testing and Materials, or ASTM tested gloves. The specific number is D6978. They must be powder-free and disposable, and it's recommended that before we place these gloves to visually inspect for defects. And of course, if there are defects, meaning any rips or tears, you should dispose of the glove and get a new pair. 2 pairs of these ASTM tested chemotherapy gloves must be used when compounding, administering, managing a spill, and disposing of hazardous drugs. The exception to this is in our assessment of risk. So as we talked about before, when we are dealing with our medications in our vertical carousels, we can utilize only 1 pair of nylon gloves. And that's because these are considered lower risk occupational exposures, and utilizing a nylon glove is enough to mitigate that risk. Gloves, especially when we're compounding with hazardous drugs, they must be changed every 30 minutes or when they are torn, punctured, or contaminated. Another example of a low risk type of situation is when we're placing intact tablets or capsules into unit dose or multi-dose containers. This is considered low risk, but the caveat here is it's a single pair of chemo-rated gloves that needs to be utilized. Thinking about the chemotherapy gowns that are used when compounding with chemotherapy medications, gowns must be able to protect a worker from spills and splashes of hazardous drugs in their waste. These gowns must have been tested to resist permeability, and they must be disposable. I want to spend a moment explaining a situation when I say disposable. So when we are compounding non-hazardous drugs in a sterile situation, if we leave, we have the ability to kind of leave our gown in the IV room and then put it back on when we come back. This is not acceptable, however, when we are compounding with chemotherapy. These gowns must be disposed of, and we must take a new chemotherapy gown when we enter back into the IV room. These gowns must close in the back, the front cannot open. And then the next bullets are really there just to ensure that we are making sure we are not in contact and allowing any way for a drug to pass through and lead to an unnecessary occupational exposure. Respiratory protection is utilized in specific situations. So personnel who unpack hazardous drugs that are not contained in plastic should wear respiratory protection. Thankfully, here at Stony Brook, our manufacturer typically ships us our hazardous drugs in separate containers from our non-hazardous drugs, and they're also individually packaged in plastic. So that might not be a requirement for us, but when there is a risk of respiratory exposure, it is recommended to wear the protection. So some examples for you is if there's a hazardous drug spill that cannot be contained with a spill kit, if there is any exposure under the work surface of a containment primary engineering control or the hood, and when there is also risk of airborne exposure to powders as well as vapors of hazardous drugs. Thinking about the disposal of this PPE, all PPE that is worn when we're handling drugs, they're considered to be contaminated with even minimum or trace quantities of hazardous drugs. They must be disposed of properly. This includes a situation even if we are drawing up an oral syringe of a hazardous medication, we need to be disposing our gloves in either trace or bulk contaminated waste, which I will explain towards the end of this presentation. Cleaning specifics, including spills and disposal. All areas and equipment that are used for sterile compounding of hazardous drugs must be sanitized. And this includes a specific process as I have on this slide. It starts off with deactivation, followed by decontamination, then followed by cleaning, and lastly, disinfection. The reason for this is the way that we're using these agents. To start off, deactivation includes examples like peroxide formulations as well as sodium hyperchlorite, which is a word for bleach. And this is actually going to deactivate to reduce the hazardous drug toxicity. That's our first step. We then want to follow this by decontamination to remove any hazardous drug residues on those exposed surfaces. Examples of decontamination products include things like peroxide as well as isopropyl alcohol. Cleaning. We want to use our germicidal detergents to make free from direct organic matter or salts. And then lastly, disinfection. And the disinfection process will inhibit or destroy growth microorganisms that may pose an infection risk. Here we can use various disinfection wipes or even the 70% isopropyl alcohol. This is an example of our hospital-approved disinfectants here at Stony Brook. I think one of the most common disinfectants that we use in the main pharmacy is on the top left, so the PDI purple top. One key point with these disinfectants is they all have specific dwell times, meaning a specific amount of time that the surface is required to retain wet before we are drying them and using them for our medications. So for the purple top, the dwell time is 2 minutes specifically. When we're cleaning a spill, always remember first aid first, then assess the spill. If there's any risk for contamination or injury to either ourselves or other healthcare personnel, first aid is always going to be the first step. Then we will want to assess the spill, and assessing the size of the spill is important in order to manage it correctly. Spills are either classified as a minor or major spill, and that has to do with the volume. If it's less than 50 mLs, it's considered minor, and greater than 50 mLs, it's considered major. Always when there's a spill, you're going to want to access the spill kit. And the spill kit can be found in materials management in our IV and main pharmacy. Some of the spill kit contents I have listed on the screen for you. So these are just some examples, but it may include things like a protective lab coat, latex gloves minimally, maybe even an N95. If there is any splash potential when cleaning these spills, the face shields as well as booties should be utilized. It also may come with the hazardous drug waste bags, as well as chemo pads to absorb the hazardous liquids, and a scoop and scraper. And the scoop and scraper is necessary because it's not recommended to use, for instance, a typical broom, especially for cleaning up any powdered, because this causes a risk and potential for aerosolization of that hazardous drug, leading to an increased risk for ourselves and other healthcare workers in the setting. They also will come with a hazardous drug spill report exposure form to document the exposure. Thinking about what to do with a minor spill, so this is less than 50 mLs, only trained departmental staff and control of the chemical can respond to a minor spill. The first step is going to be secure the area, review those safety data sheets that we talked about before if needed, and really confine and contain that spill. We want to make sure the spill is not spreading to other areas, so use those absorbent pads, even surround that spill to make sure it is not spreading. The last step is going to be to contact environmental health and safety at this number for proper waste disposal. Major spills greater than 50 mLs. This is a little bit different. It's recommended to notify coworkers and have the area evacuated if necessary. First and foremost, secure the area. And really, I think the biggest take home here is to call the appropriate help to see how to work with this spill. So we can call university police as well as our environmental health and safety office. Reporting spills is required if there is personal injury or contamination of employees. It requires this employee injury and illness report. It's also recommended to complete the hazardous drug spill checklist, which might be in the spill kit, and provide those copies to a supervisor, pharmacy, and employee health and wellness, as well as employee health and safety. Thinking now about our disposal, we have our yellow bins and our black bins. The yellow bins are specifically used for trace waste. Some examples are included here. So our PPE, for example, any of our gloves that we use to draw up or dispense hazardous drugs, as well as any empty vials, syringes, or bottles, and used absorbent pads. Black waste bins are for bulk. So I think B for B, black bin for bulk waste. And this includes the waste for any partially empty IV bags, empty syringes that are partially emptied, as well as partially emptied vials. So any type of container that still has a decent amount of our hazardous drug in it would be considered bulk waste. Given that information, I have this question. You are about to draw up an oral syringe for an order of a phenytoin suspension, which isn't hazardous drug under the NIOSH list. However, you notice the suspension bottle has an expiration date of October 1st of 2021, keeping in mind today is November 18th of 2021. Upon further inspection, you realize about 1/4 of this expired phenytoin liquid remains in the bottle. Where would you dispose this bottle? Is it A, the black bin, B, the normal trash bin, C, a red bin, or D, a yellow bin? And the key to answering this question is we still have some liquid left in it. Exactly. So A, the answer is the black bin. And the key here, like I said, is since we still have some of this hazardous drug left in the bottle, it would be considered bulk waste and should be placed in the black bin. The next question is, now you have a different scenario where you finished drawing up an oral syringe for an order of phenytoin suspension. After finishing, you remove your gloves and you would therefore dispose them in which bin? Yes, so yellow. This would be considered trace waste, and all trace waste should be put in our yellow bins. I have some resources listed for you in case you want to refer to anything, or if you have any further questions about what I talked about. The USP and CDC, as well as ASHP, have really awesome guidelines and resources on hazardous drugs. Of course, we have that NIOSH list. And then I also included the Stony Brook Environmental Health and Safety phone number for your references. Overall, you have a right to know. In conclusion, Stony Brook is held accountable to these USP 800 standards. Compliance to these standards, as well as our assessment of risk, specifically here at Stony Brook, is important to ensure the protection of you, as well as the rest of our staff. Here are references for my pictures. And thank you all for your time. I appreciate you coming. I will now open the floor if you have any questions.